Hello, my name is Enoch Mwansa, fourth year student of physiotherapy here at Mawadi University. In this video, we'll be looking at the auscultation of the lung sounds. Now, what is auscultation? Auscultation is a process of using the stethoscope to hear the flow of the air through in the lungs through using the stethoscope. It's one of the important assessments. Now, when we talk about assessment of the lung sound using auscultation method, anteriorly we look at, when we are measuring the apices, we normally look at the points of the slightly upper clavicle. Then you go to the 6th rib also. Then you check for the auscultation. Then posteriorly, we look at, when you are talking about the apices, we look at the C7. On the sides of the C7, that is where the apices are located. On the other hand, we also look at the axillary, the lateral side of the axillary, and on the portion of the 7th and 8th rib, that is where it is located. So with me here, I'm having the patient. Now, before I touch the patient, I want to discuss about the types of lung sounds. So we have basically 4 types of classification of lung sounds. The first one is the normal lung sounds. Under the normal lung sound, we've got bronchiovascular, and we have got also vesicular. Now, under broncho, it is one of the high-pitched sounds, which is it is not it is continuous, though it has phases during inspiration and expiration. It is normally heard on the trachea. Now, when we talk about the bronchiovascular is one of the continuous high-pitched lung sound, which is normally heard from the bronchial and as well as the lung tissue between the 2 bronchi. And when we talk about the vesicular, it is the low-pitched lung sound, which is heard on the peripheral lungs. On the other hand, we have also what we are calling the abnormal lung sound. Under the abnormal lung sound, this normally happens for example, we have got bronchial and the decreased, or the point where there's no sound. So in that bronchial abnormal lung sound, it is a high pitch that is heard in the peripheral lungs. This simply can be because of the pneumonia. There's a wheezy or whistling type of the sound that we feel because of the pneumonia. This is a high pitched type of lung sound. On the other hand, we are also having the decreased. The decreased lung sound, it is where you look for the type of the visceral type of vesicular type of lung sound, where we hear the sound on the peripheral lungs. In this case, this one can be caused because of emphysema or any tumor in the lungs. On the other hand, we've got adventitious type of lung sounds, under which we have got crackles, which are quadrilles. We have also called the other one, which is the lonche, as well as the wheezy sound. On the crackles, these crackles are discontinuous type of sound. This discontinuous type of sound are heard like the rubbing of the hair on the fingers. On the other hand, we have got the ronchi. This ronchi is a type of sound that is normally heard. It's just like due to the abnormalities in the lung. On the other side, we have got the wheezy sound. This wheezy sound sound like a whistling sound when we are using the stethoscope, listening from the lung sound. On the other hand, we have got also extrapulmonary lung sound. These are due to the rubbing of the pleura and the viscera of the lung tissues that covers the lungs. When there's a rub, maybe due to pneumothorax and all other type of pathologies in the lung, it normally occurs. On the other hand, so when we look at this type of lung sound, it usually gives us an idea or an ideology on what to follow. So with me, I have a patient on whom I'm going to test the lung sound. So I'm going to press my stethoscope. I will start with the apices to listen from there. So we need to test if the sound is coming out. So from him, I'll ask him to open the mouth. Just open your mouth. So you're going to deeply from your mouth. Breathe out. Okay. On the other hand, I'll test another point. Breathe in with your mouth. Breathe out. All right. Okay. Breathe in with your mouth. Breathe out. Okay. Again. Breathe in. breathe out. So from him, I can hear the sound is just normal. There's no abnormality detected. There's a high-pitched sound that you can notice from him. So on the other hand, I'll ask him to go posterior. Now we are going to test for the posterior lung sound. So just be like this, turn around like this. So now for the apices, as I said from the beginning, from the apices, we are going to test from the C7. So the location of the C7, this is a prominent site. Then on the other hand, please open your mouth and breathe in, breathe out. Okay. On the other hand, we are going to look at for the T10. Okay, the T10 is somewhere here. So please breathe in, breathe out. We are going to go to the axillary level, side below the scapula. Please breathe in, breathe out.